Osteomyelitis is the condition of the bone. Osteo means bone. Myel comes from the word myelose, meaning bone marrow, and itis means inflammation. So the inflammation of bone and bone marrow is what we call osteomyelitis. The question is, what's the reason behind inflammation, or what's the reason behind osteomyelitis? Almost all the time, virtually always, osteomyelitis is caused due to an infection. So basically, a pathogen, it somehow via any route enters the bone, causes infection of that bone, and this infection results in the inflammation of the bone and its marrow. This is osteomyelitis. So, in other words, you could say that osteomyelitis is the infection of the bone that results in the inflammation of the bone and its marrow. So, pathogen causes the infection of the bone, which results in the inflammation of the bone and its marrow, and this is what we call osteomyelitis. I have been repeating the pathogen word again and again, that pathogen causes osteomyelitis. So the question is, what are these pathogens that cause osteomyelitis? So the pathogen can be a fungi or a virus or parasite or bacteria. Most commonly, osteomyelitis is caused due to bacteria. Sometimes it can be caused due to parasites, and rarely it's caused due to an infection by fungi or virus. Now, these pathogens, upon infection of the bone, will produce pus or will not produce pus. If it produces pus, then that osteomyelitis is called pyogenic osteomyelitis. If it does not produce any pus, then that osteomyelitis is called non-pyogenic osteomyelitis. So, on the basis of whether pus is produced at the region of inflammation or not, osteomyelitis is of two types. There's your pyogenic, there's your pyogenic osteomyelitis, which is caused due to a pyogen or pus forming microorganism, or non-pyogenic osteomyelitis, which is caused by a pathogen or a microorganism that does not produce any pus. First, pyogenic osteomyelitis. The most common microorganism that causes pyogenic osteomyelitis is Staphylococcus aureus. Staphylococcus aureus is a bacteria, and it is the most common pathogen, most common microorganism, most common pyogen that causes pyogenic osteomyelitis. There are other pyogens as well. For example, during sickle-celled anemia, along with Staphylococcus aureus, Salmonella is also present that causes pyogenic osteomyelitis. Also, in case of sexually active individual, Neisseria gonorrhea can also lead to pyogenic osteomyelitis. Rarely, fungi can be the cause behind pyogenic osteomyelitis. Alright, second type is non-pyogenic osteomyelitis, where there is no formation of any pus. And the most common bacteria that causes this osteomyelitis is Mycobacterium tuberculosis. The type of osteomyelitis caused by Mycobacterium tuberculosis is tuberculous osteomyelitis. So tuberculous osteomyelitis is a type of non-pyogenic osteomyelitis which is caused by Mycobacterium tuberculosis, which is the most common pathogen causing non-pyogenic osteomyelitis. So under osteomyelitis, there are two types that we need to know. Number one is pyogenic osteomyelitis, where there is formation of your pus at the region of inflammation. And the most common pathogen causing pyogenic osteomyelitis is Staphylococcus aureus. And second is tuberculous osteomyelitis, where the cause is Mycobacterium tuberculosis. So here are some major structures of a long bone. The two ends of the long bone, so here's one end and here's the other end, are called epiphysis. The shaft of the long bone is called diaphysis. At the end of epiphysis, there's a plate, and this plate is called the growth plate, or sometimes it's also called the epiphyseal plate. Sandwiched between the growth plate and the end of diaphysis is a region which I have marked with the help of color blue. This region actually forms the growing end of diaphysis, and it's called the metaphysis. So right between the growth plate and the end of diaphysis is the metaphysis, and metaphysis is nothing but the growing end of diaphysis. Inside the long bone, there's your bone marrow. The bone marrow is covered with the help of a fibrous connective tissue which is called endosteum, and the bone itself is covered with the help of fibrous connective tissue from outside, and this layer is called periosteum. The importance behind knowing all of this is that it's very difficult to infect a bone due to this protective outer covering of periosteum. So there's a fibrous connective tissue that forms the outermost covering of the bone, and it's really difficult for a pathogen to enter the bone as long as that periosteum is present there. So how exactly do pathogens even cause the infection? Well, they have few tricks up their sleeve, and there are few routes with the help of which they are able to infect the bone. And these routes are what you are going to know now. First route of infection is the hematogenous route. That means by bloodstream. Let's say this bacteria right here holds the capacity to cause osteomyelitis. This bacteria somehow enters the bloodstream. In the bloodstream, the bacteria travels in the form of bacteremia. What is bacteremia? Bacteremia is nothing but a bunch of bacteria that are traveling in the bloodstream but not actually proliferating. For bacteremia of your blood circulation to occur, or bacteremia in your blood circulation to occur, there has to be an origin or a source, right? So there has to be a source of bacteria that can cause osteomyelitis, so that these bacteria can finally somehow enter your blood vessel, and inside the blood vessel they can travel in the form of bacteremia and finally reach your bone and cause osteomyelitis of the bone by infecting the bone. So what are these various sources or origin of bacteremia? Well, the first one is contaminated needle. If you inject yourself with a needle that is contaminated with bacteria that can cause osteomyelitis, then those bacteria can easily enter your circulatory system, and through the circulatory system, the bacteria can travel in the form of bacteremia and reach your bones where it can cause osteomyelitis. Second is dental extraction. When your tooth is extracted, then the blood vessels are exposed and they are susceptible to infection. Similarly, distant focus of infection. This means that the focus of infection or the origin of bacteremia is at a point in your body, and from that point, the bacteria enters your circulation. For example, let's say your skin is infected, your the dermis of the skin is infected, or maybe you have a boil. At that region, there are many bacteria that can cause osteomyelitis. From that particular region, or the region of boil, the region of infected area on your skin, the bacteria enters your bloodstream and then travel through the bloodstream to your bone. Similarly, the point of focus can be in your visceral organ as well. It can be in visceral organ of your gastrointestinal tract. It can be in your visceral organ of urinary system. It can be even in lungs. Here's an example. Let's say you have tuberculosis. That means Mycobacterium tuberculosis has infected your lungs. So there's a point of infection in your lungs where Mycobacterium tuberculosis has infected, right? From that point of infection, Mycobacterium tuberculosis can now enter your bloodstream. Once it enters your bloodstream, through the bloodstream, it can travel to various bones in your body. Let's say Mycobacterium tuberculosis travels to the bones of your foot. There, then it can cause the infection of the bone of your foot and then lead to the osteomyelitis of the bone of the foot. And finally, through trivial mucosal injury, something as trivial as the abrasion of a mucosal lining. Let's say you are chewing a food that is hard and rough. The roughness of the food leads to an injury of the mucosal lining of your buccal cavity. Even through that, infection can occur and enter your bloodstream. Or let's say you are constipated and trying to defecate, and you apply a lot of force while pooping. What happens? The poop tears the mucosal lining of the anus. That can be a source for infection to enter inside your bloodstream. And that's how bacteria that can cause osteomyelitis can finally reach your bone and cause osteomyelitis. Let's say the bacteria that is present in your circulation somehow fights through the immune system of the body. It somehow evades the immune system of the body. Then through the blood circulation, it finally reaches the bone and infects the bone. The most common site of infection in children, I repeat, the most common site of infection in children is the metaphysis of the bone. And the most common site of infection in adult is the vertebra. Let's say this pathogen right here is Mycobacterium tuberculosis. Mycobacterium tuberculosis fights against the soldier of your body, evades the immune system. Then it travels and reaches the vertebra in adult. In the vertebra, Mycobacterium tuberculosis causes tuberculosis, which is called spine tuberculosis, which is also called Pott's disease. Get it? Okay, again. Listen carefully. Mycobacterium tuberculosis can cause pulmonary tuberculosis, which is the tuberculosis of the lung, or extrapulmonary tuberculosis, which is tuberculosis of organs or parts other than lungs. Let's say Mycobacterium tuberculosis in this particular condition evades the immune system and through the circulatory system in adults reaches the vertebra or the spine. In the spine, the bacteria causes the tuberculosis of the spine, and this tuberculosis is called spine tuberculosis. This has been given a special name of its own, and it's called Pott's disease. Spine tuberculosis or Pott's disease is characterized by spine osteomyelitis. So that's how spine osteomyelitis is caused. So the commonest site of infection by hematogenous route in children is metaphysis of long bone, and in adult is vertebra. The second route is by direct extension. Let's say there's a focus of infection or a soft tissue infection near a bone. So here's a bone, and near this bone there's an abscess right here, which is a focus of infection. If this abscess is left untreated, it is going to proliferate. Let's say this abscess proliferates right below the skin. As a result, the cells below the skin goes through the process of necrosis. The infection proliferates and finally reaches the bone, where it destroys parts of periosteum. Once breach in the periosteum occurs, the infection can easily enter the bone and infect the bone itself, leading to osteomyelitis of the bone. Now, this way of infection is different than the hematogenous route that I talked about. In hematogenous route, I said that there might be a focus of infection on your skin, maybe in the form of a boil, and the bacteria that are present in that focus of infection enters your bloodstream, and then it is from the bloodstream that the bacteria travels and reaches a bone where it causes the infection of the bone. However, in this particular condition, the untreated infection directly extends from the focus of infection till the bone, and then finally infects the bone. So there is a direct extension of the soft tissue infection from the site of infection till the bone itself. So this is what happens. First, neighboring to the bone, there's soft tissue infection. Second, the soft tissue infection is left untreated. Third, as a result, the infection proliferates. Fourth, necrosis of the cells below the skin or at the region of infection occurs. Fifth, the infection reaches the bone itself. Sixth, breach in periosteum at the region of infection occurs. 7. If the periosteum is destroyed, the infection can easily enter inside the bone. And 8. Once the bone is infected, it leads to osteomyelitis of the bone. The best example of direct extension is ulcer in diabetic foot. Basically, the foot of a patient suffering from diabetes, it develops an ulcer, and through this ulcer, the infection is able to enter inside the body and finally reach the bone where it can cause osteomyelitis. But first things first, how does an ulcer develop in the foot of a diabetic patient? In diabetes, the patient loses his sense from the foot. There is loss of sensation from the foot. This is because of the damage of the nerves supplying the foot, and this is called diabetic neuropathy. So since there is loss of sensation from the foot, the patient keeps on injuring the foot without even realizing it, because it does not hurt. Since it does not hurt, the patient is not going to realize that he or she has injured his or her foot. So there's injury of the foot. Second, atherosclerosis leads to a decreased supply of blood to the foot. As a result, the foot becomes ischemic and the cells around the region of injury become necrotic. And this is why the injury is unable to heal itself. So there is injury of the foot, and adding to the injury of the foot, there's ischemia, which makes it unable for the injury to heal itself. As a result, the injury develops into an ulcer. It is through this ulcer that the bacteria is able to travel and reach the bone. The bacteria is also not killed by the immune system because a diabetic patient is immunocompromised. So as the ulcer deepens, the bacteria also enters inside, and as the ulcer deepens to a point it reaches the level of the bone, the bacteria also reaches the bone and infects the bone, causing osteomyelitis. And this is how extension of something that is happening near the bone in the soft tissue can lead to osteomyelitis of the bone itself. The third way is by direct implantation, where the bacteria is directly implanted into the bone. For example, during open fracture, the bone is exposed. To the exposed part of the bone, the bacteria can get implanted. This can lead to the infection of the bone. Second, during surgery, the surgeon might use surgical equipments that are not disinfected or sterilized, carrying infection causing pathogens that can get implanted into the bone. Or during orthopedic surgery, the surgeon might use orthopedic implants that are pre-infected with such infections or such pathogens. And thirdly, during penetration, during a trauma by penetration, for example, here the leg has suffered a trauma due to the penetration of a rod through the bone of the leg, which is the femur. During penetration, the rod might be carrying the bacteria causing infection with it, and this bacteria can get directly implanted into the bone. Now let's look at the pathophysiology of osteomyelitis. What actually happens once the bacteria infects the bone to result in osteomyelitis of the bone? For us to understand pathophysiology, I am going to take one of the most common type of osteomyelitis, and that is metaphyseal osteomyelitis. Metaphyseal osteomyelitis is the most common osteomyelitis that is seen in children. And one of the most common pathogen that causes this condition is Staphylococcus aureus. See, Staphylococcus aureus is a pyogen, that is, it produces pus. So, Staphylococcus aureus is the most common pathogen that causes pyogenic osteomyelitis. In children, I repeat, in children, the most common site of infection is the metaphysis of the bone. So, the type of pyogenic osteomyelitis caused by Staphylococcus aureus in children is metaphyseal osteomyelitis. Okay, enough talking. Let's see what exactly happens once the bacteria invades the bone. Firstly, there's Staphylococcus aureus in the bloodstream in the form of bacteremia. The bacteria enters into the nutrient artery, which is supplied to the long bone. The nutrient artery, once it enters the long bone, it gives off two branches, an ascending branch and a descending branch. Since these branches they are present within the medullary cavity or within the bone marrow, they are also called medullary artery. So the nutrient artery supplies blood to long bone. Along with the blood, it is also carrying Staphylococcus aureus. The nutrient artery bifurcates into medullary artery. The medullary artery, again, it divides to give off many branches. These branches of the medullary artery, they meet with the sinus, with venous sinus. And the venous sinus, they meet to form medullary vein that finally comes out. Okay. So this particular arrangement of the blood vessels that you can see in the region of metaphysis is what we call hairpin arrangement, because the arrangement of the blood vessels kind of looks like a hairpin. That's why. The reason this particular arrangement is so important is because Staphylococcus aureus has its favorite place to inhabit, and its favorite place is right here, right here, right here, right here. That is at the junction between the artery and the venous sinus of the hairpin arrangement within the metaphysis. Again, so there's your normal blood circulation. The blood circulation contains bacteremia, and the bacteremia is of Staphylococcus aureus. The blood circulation gives off blood vessels, arteries. One of the arteries is nutrient artery that supplies to the long bone. Staphylococcus aureus along with the nutrient artery enters the long bone. Inside the long bone, the nutrient artery gives medullary artery. The medullary artery, it divides into many branches. These various branches, they meet with the venous sinus. These various venous sinus, they recombine to form medullary vein that comes out of the long bone. At the junction between the artery and the venous sinus of the hairpin arrangement of the blood vessels within the metaphysis is where Staphylococcus aureus best inhabits. It's the favorite place for Staphylococcus aureus to inhabit. And there are three reasons behind it. Reason number one, at this particular place, the blood flow is slow. Since the blood flow or the velocity of the blood is slow, the speed with which Staphylococcus aureus travels also becomes slow. So there's a high chance for the accumulation of the bacteria. Similarly, the blood flow is also turbulent, meaning here's a blood vessel. Inside this blood vessel, here's the laminar flow of the blood. If there is laminar flow of the blood, the bacteria that is present at the middle won't hit the wall at all, and it will continuously flow in a linear fashion. However, if the blood flow becomes turbulent, the blood will start hitting the wall in a random fashion, and so will the bacteria that is present inside the blood vessel. It will also start hitting the wall. Since the bacteria also hits the wall, it will also get accumulated due to the friction between the bacteria and the wall of the blood vessel. Number one. Number two, Once the bacteria gets accumulated here, it can get phagocytosed by WBCs. However, at this particular region, there is very low count of WBCs. So the bacteria is safe there. Number 3, on the surface of the bacteria, there are certain proteins, surface protein, that allows the bacteria to attach itself with the matrix of the bone. So there are 3 main reasons that allow Staphylococcus aureus to best settle at this particular place within the metaphysis. Fine. The first step was settlement of bacteria. But once the bacteria settles, it's not just gonna stay idle there. It will start proliferating, spreading, increasing its number. As you can see in this diagram, this is where the bacteria settles and proliferates. This particular bacteria, I have been repeating again and again, is a pyogen, that is, it produces a pus. This bacteria also releases destructive enzymes, and the destructive enzymes, they destroy the mesenchymal cells or the bone cells at this particular region, leading to necrosis. Since the necrosis is brought about by a microorganism that produces pus, since the necrosis is brought about by pyogen, the type of necrosis is liquefactive necrosis. I hope you know this much. There are 5 types of necrosis that you need to know. There's coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Among them, liquefactive necrosis is like a war zone. Because at the region of liquefactive necrosis, you are going to find a lot of cells that are fighting to either protect or destroy other cells. See, here's the war zone. What's actually happening here? Initially, there were mesenchymal cells or the cells of the bone. The bacteria or the pyogen, they secrete destructive enzyme. These destructive enzyme, they destroy the architecture of the mesenchymal cell. Initially, the mesenchymal cell is like this. Once the bacteria releases destructive enzyme, the wall gets destroyed and the cytoplasmic content within the cell comes out. The cytoplasmic content within the cell comes out. The cytoplasmic content within the mesenchymal cell, that is the cell of the bone, comes out. This cytoplasmic content leakage triggers inflammation, and you have to know that necrosis is always accompanied by some sort of inflammation. Since there is inflammation, soldiers are going to come in order to protect the cell by killing the bacteria and also by killing the necrosed cells. For the first soldiers to arrive are neutrophils, the multinucleated neutrophils. The reason being, they are large in number, they are highly motile, and the chemoattractants attracting neutrophils are released first. Secondly, macrophages appear. About 24 to 48 hours later, macrophages appear for the process of phagocytosis. Since there is inflammation of the blood vessel, the content of the blood vessel, they also leak out, and this content is none other than exudate, and exudate is highly rich in protein. So at this place, what are you going to find? At this particular place, you are going to find normal cells that are either dead or they are dying due to the destructive action of the enzymes released by bacteria, or they are still alive. You are going to find bacteria, the pyogens, that are either dead, dying, or alive. You are also going to find WBCs like neutrophils and macrophages that are dead, dying, or still alive. And then you are going to find all these cells floating on a liquid rich in protein called exudate. This is the site of liquefactive necrosis. The reason it is called liquefactive necrosis is because the mesenchymal cells have been destroyed to a point it has turned into semi-liquid. So the destructive enzymes secreted by the bacteria, the phagocytosis of the neutrophils and macrophages have destroyed the cells of that region to a point that they have converted to semi-liquid. So you can't see any mesenchymal cells at these regions. All you see are these bacteria that may be dead or alive or still dying. And this reason of liquefactive necrosis is your pus. So what is pus? Pus can be defined as the site of liquefactive necrosis where you will find number one, dead, dying, or alive mesenchymal cells or normal cells. Number two, dead, dying, or alive bacteria or pathogen. Number three, dead, dying, or alive WBCs like neutrophils or macrophages. All of them floating on a liquid rich in protein called exudate. Okay, one more revision. So what happened? There was settlement of the bacteria at this particular region. There were three major reasons for its settlement. Once the bacteria settled here, it proliferated, that is increased in number, and then they started secreting what? They started secreting destructive enzymes. These destructive enzymes, they initiate the process of necrosis, and the type of necrosis that take place right here is liquefactive necrosis, because the necrosis is being brought about by a pyogen, that is pus forming microorganism. So at this particular region of necrosis, you are obviously going to find pus. So what is going to be inside the bone? Pus is going to be inside the bone. This pus is rich in bacteria. The pus is going to increase in amount as the necrosis continues. The pus, it is not just going to stay contained at this particular region, right? It is going to spread and enter everywhere it can. So where can it enter? Since there is metaphyseal plate right here, the pus is unable to penetrate through this region and go up. However, in other conditions, like in case of children under the age of 1 year, or in case of adults who don't have plate anymore, the pus can enter joints and cause arthritis of the joint, which can be very, very dangerous. But let's take this example right here, where we have a children where the plate is still intact. So the pus is unable to go up. So where will the pus go? The pus will enter every pipe it will find. It will find any pipe in the bone and it will enter there. So within the bone, what are the various pipes that you are going to find? There are Haversian canals within the bone that carry blood vessels and nerves, Haversian canals. And these Haversian canals are connected to one another with the help of these oblique canals called Volkmann canal. There are Volkmann canal coming from the medullary artery as well. And then there are Volkmann canal coming from artery in the periosteum called periosteal artery as well. All these canals, they are going to get filled with pus. The pus is going to enter everywhere. It's just going to fill every hole every pipe it's gonna find. And then pus will start coming out. However, there is a layer of periosteum, right? What the pus will do is that it will push the periosteum outward, such that the periosteal will be pushed outward and the pus will be collected right behind the periosteum and form an abscess right here. This abscess, which is basically a localized pus, abscess is a localized pus. This abscess right here is present behind a covering of periosteum. So it's called subperiosteal abscess. During the formation of subperiosteal abscess, the periosteal blood vessels also get destroyed. See, what has happened is that pus has entered every pipe it has found. Since it has entered every pipe it has found, we also know that these pipes, they carry blood vessels. So the blood vessels have also been jammed with pus. Once the blood vessels have been jammed with pus, this whole region is devoid of blood now. Because the blood vessels are jammed, there is no flow of blood to this region. That means this region becomes ischemic. And what happens after ischemia? Necrosis happens after ischemia. So that whole region becomes necrosed. A whole chunk of bone becomes necrosed and dead. This is a chunk of bone, whole chunk of bone that is completely dead, and it is rich in bacteria. And this whole chunk of dead bone is what we call sequestrum. So sequestrum is a chunk of bone that is completely necrosed due to pyogenic bacteria infection of the bone. Now, you can't give antibiotics to cure sequestrum. The reason being, antibiotics needs a route to reach the site of infection, and that route are blood vessels. But the route, that is blood vessels at this region, are completely destroyed due to pus. So antibiotics can't reach sequestrum. So the only way to remove sequestrum is by surgically removing it. Then what? Then what happens? Your body still doesn't give up. It still doesn't give up, still wants to fight. So this pus, what does it contain? It contains bacteria, your normal cells, your WBCs that are either dead, dying, or alive, right? The WBCs, that is neutrophils and macrophages, they produce cytokines. They produce cytokines. And these cytokines, they indicate periosteum as well as endosteum. They send messages to periosteum as well as endosteum. To do what? So periosteum and endosteum, they contain stem cells that form your bone cells. So cytokines message those stem cells to form more bone cells or new bone cells. So periosteum starts forming bone cells from this direction, and endosteum starts forming bone cells from this direction. So you get a layer of bone cells from this direction and a layer of bone cells from this direction. The two layers of bone cells, they act as involucre for the dead chunk of bone that is present in the middle, or for sequestrum. And these two layers are called involucrum. So what are the two major things? There's formation of sequestrum, and then there's also formation of involucrum. However, we are still not done. The pus is still proliferating. Necrosis is still proliferating because the treatment has not started yet. The surgery has yet not been done. The pus is still proliferating to a point. The pus breaks out of periosteum. How? It forms a gap in the periosteum, and this gap acts as a channel, and it's called cloaca. Through this cloaca comes out the pus. Once the pus comes out, it leads to the necrosis of the nearby soft tissue. See here. So here's the cloaca. Through the cloaca, pus comes out, which leads to the necrosis of the soft tissue nearby. If the region of cloaca is near the skin, then it communicates with the skin as well. Once the pus destroys the soft tissue, it forms a gap, and this gap is called a sinus. If this region is close to the skin, then through the sinus it is able to communicate with the skin, and the pus is able to come out into external environment. Later on, what happens is that the sinus gets epithelialized, that is internally lined by epithelial tissue. Once it gets internally lined by epithelial tissue, it becomes permanent. It becomes permanent. That means now it stays as it is. So the pus that developed inside the metaphysis of the bone has come to a point outside the skin. That much it has proliferated. One last revision for everything. So what exactly happens? There's Staphylococcus aureus in normal circulation. The Staphylococcus aureus enters the bone through nutrient artery. In the metaphysis of the bone, there is hairpin arrangement of blood vessels. At the intersection between the artery and the venous sinus, the Staphylococcus aureus finds the best place to settle. There are three reasons behind it. Reason number one, the blood flow here is slow and turbulent. Reason number 2, there are less WBCs, so less phagocytic activity takes place there, so the bacteria is able to survive there. Reason number 3, there are surface proteins on the surface of the bacteria for it to attach with the matrix of the bone. Once the bacteria settles here, it proliferates. The bacteria is pyogenic, so after proliferating, it brings about the necrosis of the tissue, and the necrosis it brings about is liquefactive necrosis. In liquefactive necrosis, formation of pus takes place. Pus is nothing but a bunch of mesenchymal cells, pyogens, WBCs that are either dead, dying, or alive, all floating on an exudate which is rich in protein. The pus has formed at this particular region, at the region of infection. The pus, it proliferates and enters everywhere it can. It enters inside Haversian canal, it enters inside Volkmann canal, and it even comes out of the bone. It forms an abscess just behind the periosteal layer called the subperiosteal abscess and destroys the blood vessels at that particular region. All the blood vessels at this particular area gets destroyed due to invasion of the pus, leading to ischemia of that region, and ischemia leads to the necrosis of that particular region bone, which is called sequestrum. Sequestrum is a chunk of bone that is necrosed due to ischemia caused by the pus due to infection by a pyogen in the bone. This sequestrum can only be surgically removed. Then, as a coping mechanism or as a resistance from the body starts making bone cells of its own. These bone cells try to cover the sequestrum and they are called involucrum. However, the pus proliferates this much that it penetrates out of the periosteum and even comes out of the body, out of the skin. Osteomyelitis is a pathological condition and it is associated with its own set of complications. In this particular type of osteomyelitis, the complications that are frequently seen are: number 1, septicemia. The bacteria causing the infection are already present in the general circulation. The bacteria adds to the general circulation through the pus that leaks out of the bone after infecting the bone, leading to the condition of septicemia. Since there's so much going in the bone becomes weak due to infection by the bacteria, and it is highly susceptible to fracture under no stress or under very little stress, and the cause behind the fracture is pathologic. So it leads to pathologic fracture. Since the cells at this region, the cells of the bone at this region are continuously irritated for a long term by the pus and bacteria and the necrosis going on, the bone may develop by mutation or by some reason may develop cancer, and that's your bone sarcoma. Even the squamous cell epithelium lining the innermost wall of the sinus is in continuous stress from the pus leaking out. So it may also develop by mutation carcinoma called squamous cell carcinoma. In case of children below the age of 1 year or in adults, the plate is not present, so the pus can easily leak to the upper side and reach the joint, where the pus can cause arthritis due to the bacterial infection. That's your bacterial or septic arthritis. Even in children where the plate is still there, the pus may leak out of the periosteum and then travel a different journey and reach the joint, where it can then cause septic arthritis. So these are the various complications: septicemia, pathologic fracture, squamous cell carcinoma, bone sarcoma, and bacterial arthritis. There's one last term that you need to know and then the lecture is over, and that is Brody's abscess. Sometimes what happens is that the bacterial infection is not that severe, that is, it's short ranged or there is only few bacteria infecting the bone. In that particular condition, if the immune system of the individual is strong enough, then they can localize the infection. What happens is that the infection gets localized at a point as it gets surrounded by granulation tissue which is rich in fibers. This happens when there is less infection and the immune system of the individual is strong. What happens then? Then the infection does not further proceed. That is, there is no further infection. That is, there is no formation of sequestrum. You won't have a necrotic chunk of bone. At least that level of disaster is not reached. And this particular abscess that you get right here is called the Brody's abscess. And that's it. Ta-da!